I'm Teri Kroll. For those of you who weren't here last year, I'm the coordinator of a group called Push LI, People United to Stop Heroin on Long Island. And while I'm encouraged by the strides made across the country by many of the people and groups here today, there's still much to be done. And for the record, just in case you weren't sure, I am still fed up. Because of that, in the past year, I have become a member of the board of directors for a group called FIST, Families in Support of Treatment. FIST is a nonprofit organization on Long Island designed to organize, support, educate, guide, and provide resources to families who are struggling with the loved one's addictions. We are determined to comfort and support the relatives of loved ones who have been lost to this disease. FIST is also committed to making a positive contribution, and we advocate for those still sick and suffering to help families caught up in a maze of insurance companies who resist paying for treatment at every turn and governmental indifference or ignorance to the crisis of the opioid and heroin epidemic. I am fed up. We have a federal agency, the FDA, which clearly thinks that the answer to the opioid crisis is more opioids. What alternative universe are these people living in? On the heels of their approval last year of Zahydro, a new form of heroin in a pill, in their infinite callousness, the FDA has once again gone against its own advisory panel's recommendations and thinks it's a good idea for doctors to prescribe OxyContin to 11 to 16-year-olds. 11-year-olds? Our 11-year-old children? We have an FDA which is out of control and seems bent on breeding a new generation of addicts by allowing distribution of one of the most powerful substances to be used in the developing brains of our children. Is it just me, or are we all fed up?
We're fed up.
Last year, I stood before you and told you of the strides we've made in New York. We've organized and band together as family members, treatment providers, concerned citizens, and people in recovery. And we have become a force to be reckoned with. I talked about the 911 Good Samaritan law we passed, which allows people to call for help for someone overdosing and not get arrested themselves. If you don't have a law like this in your state, call your Attorney General and get one started. I described how we demanded change and passed legislation requiring a real-time internet reporting system to track overprescribing, called the iStop law. And you know what? It's working. In New York, the Department of Health reports cases of doctor shopping has been cut by over 90%. But that's not enough. We need to have this type of system nationwide so that people can't go to other states to buy drugs. We need to do this nationwide. Please contact your attorney generals. We also took on the insurance companies, which had their own secret code of how to and if to pay for detox or rehab, which is nearly impossible to meet. We held their feet to the fire, and as of April 1st of this year, when the law changed, we have begun seeing less people denied treatment, longer stays in detox, and rehabs without getting kicked out. But it's far from perfect, and lots of abuses and gray areas, so we will keep pushing until these companies, which are making record profits, live up to their end of the bargain and assist our loved ones in getting the help that they deserve. But after a string of legislative successes and progress, we hit a brick wall. And in this past session, in trying to pass a mandated requirement that doctors prescribing narcotics receive 3 hours of continued education, not 3 additional hours, 3 hours of their already mandated hours. The medical societies fought us tooth and nail, and they won. What happened to physicians being told to do no harm? So I'm fed up. I call on Michael Botticelli, Director of the National Drug Control Policy and a person in recovery himself, to push for national legislation requiring doctors to learn more about what they're doing to their patients. and recognize this opioid epidemic that was started at the hands of a prescription pad. This must stop. The days of a dentist giving a prescription for 90 Percocet for a tooth extraction or oxys for a mildly strained back. This must stop. I am fed up. Like many of you here today, I know all too well the pain and sadness which this disease has brought to too many families. My big, beautiful boy, my hero, Timothy, paid the ultimate price at the hands of a drug dealer, masquerading as a physician who used his medical license to knowingly prescribe Timothy into addiction. We lost Timothy on August 29, 2009, to a heroin overdose, and we sadly joined the ranks of a club whose membership keeps growing and growing. Since we have gathered here last year, we have lost over 40,000 people. While the pain and loss experienced by many in this crowd, as well as my husband Frank and myself, have not diminished, we know that our hero Tim, or your hero Tom, or your hero David, or your hero Mark, or your hero Cynthia, or Michael would want us to stand up and say, no more, not one more, we are fed up. As we walk toward the ellipse and we pass by the Lincoln Memorial, I'm reminded of the stirring words and passion of Dr. Martin Luther King, who struggled to bring social justice and change to this country. Many are calling the opioid and heroin epidemic a public health crisis and demanding federal response. To me, this is all about fairness and decency in treating people with an illness and eliminating the shame and discrimination those suffering with substance use disorders have to face to get help. To paraphrase Dr. King, great moments have often come forth because there were those individuals who were willing to stand up and say, I will be obedient to a greater calling, to a greater purpose. We have a moment like that before us today and this weekend. We have a greater purpose. We have to give voice to those who have been silenced and can no longer speak. We have to give voice to the many who are suffering in isolation and don't know how to get help. There is no greater purpose than to use the fuel of our personal pain and stand up and dedicate ourselves to saving a life by our commitment to what is right. Together we are stronger. Please stand with me now and let our voices be heard. March on with dignity and love, and know our loved ones see us and will cheer us on as we demand change now. Our truth goes marching on. I would say to the FDA, we are fed up. We are not going to take this anymore. I encourage you all to march with us across Independence Way, past the Lincoln Memorial. Think about our loved ones, and we'll meet you at the ellipse.